Welcome to Community Roundtable. I'm Nick Burns from the Salt Lake Community College Division of Communication and Performing Arts, and I'm your host as we explore topics of special interest and concern to the residents of the cities and all the unincorporated areas of Salt Lake County. And these are topics that we feel are equally important to the general public throughout all the state of Utah. And today on Community Roundtable, our topic is mental illness. During our lives, 1 in 5 individuals will suffer from a mental illness. Every 2 days, 3 Utahans commit suicide, over 600 a year, and suicide is the leading cause of death for Utah's teenagers. Many of these tragedies are due to a diagnosable mental illness. Still, mental illness is treatable. The Utah Suicide Prevention Coalition has a 9-goal suicide prevention plan, and truly, why is mental illness looked at any differently than any other illness? So today, on Community Roundtable, we talk with the National Alliance on Mental Illness Program Director of Prevention by Design, Kim Gardner. Welcome to the show.
Thank you. It's my pleasure to be here.
Oh, thank you very much. National Association on Mental Illness, NAMI, everyone knows you by. Your motto is treatment works, recovery's possible, you are not alone. I mean, very positive, very engaging. So the National Alliance, who are you all and what do you do?
NAMI is a nationwide grassroots started by a couple of moms in 1977 whose kids were experiencing mental health conditions, and they were frustrated and worried and disturbed about what was happening or what was not happening. And from there we have grown to a nationwide nonprofit with chapters all over the state. And so you mentioned hope. One of the huge messages at NAMI is hope. Thank you for mentioning that.
So hope for people who are suffering, but hope for family members, hope for neighbors, hope for improvement in the future towards helping people. I mean, it seems like we're in a world of hope these days, I hope.
Well, and it is all of that. It's hope for a more fulfilled life. It's hope for dreams. It's hope for aspirations, even in the face of, and not just because of one's mental illness. It should not be defining. And so, yeah, that's one of our mottos is hope, help, and healing.
And it sounds like you work in the support, you work in advocacy, you work in education, your own work specifically suicide prevention.
Correct.
So, and yet this is a second career for you.
It is. Yeah.
So,
I am in a second career. I was involved with NAMI in Colorado, which is my home. And I came to Utah to pursue other interests and to be involved with NAMI on a volunteer basis, and things developed where, because of my own experiences with mental health and suicide ideation, I was offered a position. I've loved every minute of it.
Oh, well, thank you for your work. So jump into this more here. When it comes to mental illness, it just seems like the words that keep coming to me are stigma, prejudice, even discrimination, that people have a really hard time thinking that mental illness isn't like diabetes or some other illness. And I wonder why you all at NAMI, why do we put mental illness like in a separate box?
Well, we're trying to change that. We're trying to improve that. One of our keynote speakers at our NAMI conference last Thursday was a lady by the name of Nev Jones, who is a researcher, got her PhD, and is now living in San Francisco. She had some real discriminatory things that happened to her on the college campus, where she was told, you cannot be here. You are an interruption. You demand too much attention. And at one point she was escorted off the college campus. That's what we're talking about. Maybe an extreme example, but that's what we're talking about in terms of discrimination.
But I mean, you think of people battle cancer, but we don't talk about battling mental illness. It's more just we blame the victim, it seems like. You're just saying.
There is a lot of blame. What we try to say at NAMI and other advocacy groups is that people live with mental illness, which implies that that's part of their life and who they are, but it does not define them. And so we all try to educate the community. And that's why I'm so grateful to be here, that brain disorders, mental illness, are no different than other disorders, other challenges that we face as human beings, whether it's cancer or diabetes or heart disease. So we've got to educate people that mental health disorders are common, they are with us, and it's not a shameful thing.
Well, you make it sound like I'm 5'5", right? I got to live with that, right?
Right.
But, suffering from schizophrenia or coping with depression, you seem to have a big job in changing that framework.
We do, but we think we're making great progress. Okay. We feel really strong about helping educate around those topics. There's something that NAMI is emphasizing now about, it's called NAMI engagement, and that is allowing a person who lives with a mental health condition, particularly a serious and persistent mental illness like schizophrenia or bipolar illness or something like that, can be engaged in their treatment and can be engaged in the community and don't have to be shunned and set aside.
And I mean, that gets into the notion of fear, that many people are afraid of folks with a mental illness, even if there's objectively nothing really to be afraid of, whereas people aren't afraid of somebody with a broken leg, really.
Exactly. The data shows that people with mental illness, for example, are by far more likely to be victims of crime than perpetrators of crime. But that's kind of the reverse of how things are perceived. And we're trying to help that. We're trying to break that.
If we have time, I want to get into that notion that so many people who are mentally ill end up in prison, which seems wrong. But you mentioned, and we talked a bit about how widespread this is. 20% of the population will have something at some point?
Right. The national data is, through the course of one's lifetime, about 1 in 5 will experience a mental health condition. And so that's why we're trying to communicate this is not a problem with your family. It's not a problem with just get up by your bootstraps and get out of bed. These are brain disorders and illnesses that can be treated, that recovery can happen, and that there is hope. So that's just going to be a communication that I have with you.
So I mean, it's very different than you're depressed for 6 months because your grandmother died or you broke up with your husband or wife. That's very different than you suffer from chronic depression.
More persistent, and when it affects your relationships, it affects your ability to form and have lasting relationships, your employment in school and that kind of thing. Those are when they become serious.
So when it starts to impact your daily functioning.
Correct.
So we need to take a quick break. When we come back, I want to talk a little bit more about what are the conditions that tend to affect people. I mean, what's out there. And also I want to get with you about your own work in suicide prevention, because I know that's a very serious problem in Utah.
Love to.
We'll be right back on Community Roundtable. Keep it tuned. We're going to talk more with Kim Gardner from NAMI, Utah. Stay tuned. Welcome back to Community Roundtable, talking with Kim Gardner from NAMI, Utah, the National Alliance on Mental Illness. And when we left off, we're talking about what tends to be the issues, the main issues for people. So at least the research I did, depression, bipolar disorder, schizophrenia, and obsessive compulsive seem to be the 4 biggies. Is Utah in the norm there, or are different parts of the country finding different things happening for folks?
Well, mental illness is complicated. Utah certainly has those mental illnesses prevalent in our populations. There seems to be a little bit more treatment-resistant depression in Utah. We don't know exactly why.
What do you mean by that, treatment-resistant?
Well, meaning people are having a time finding the right treatment in their care. That's called treatment-resistant depression. So whether it be a combination of medication or therapy or whatever. But yeah, the Utah experience is pretty common to other Intermountain states kinds of experiences for mental illness.
Because we've seen that research that says the suicide rates go up when the oxygen goes down because we live at a higher altitude, and other people are saying that's bunk, and seems a little bit unclear.
Well, it's suicide is complicated. Mental illness is complicated. There is a study from the University of Utah about the impact of suicide death. We know that we in Utah share common suicide rates and attempt rates with other Intermountain states, and so that is a theory. And some challenge that, but more effort, more research needs to be done.
So again, cause and effect or correlation, right?
Right.
Whether people just happen to live here, then you'd have to look at what about people in Nepal who live at 6,000 feet, or right? It could get very complicated. I wonder, when you talk about treatment, who pays for all this? I mean, healthcare insurance sometimes, Medicare, Medicaid. The societal benefits, I think, seem obvious probably to most people, but when it comes down to it, who's picking up the tab to help folks?
The outcomes when we spend money for early identification of mental illness, and we get people the help they need early, the outcomes are so much better, the costs to society are so much lower, lives are improved, communities are improved. So, the payment question that you've asked is multifaceted. There's a public mental health system, there's Medicaid, there are private systems, but what we're trying to do is to help people recognize, don't be ashamed of what you're experiencing, reach out for help, and help is available. That's part of the problem maybe in the Intermountain West, is that we try to tough it out, and the help is not quite as robust as it may be in other parts of the nation.
Do you think the help is less robust, to use your word, because people want to tough it out, or because we tend to have more conservative government structures that are less inclined to support public services, I wonder?
Maybe both. Maybe a little bit of both.
Or the cowboys we've elected into office are tough it out.
But we're also we are also from a cowboy culture.
Yeah, exactly.
West, and that applies to men. And when we chat about men, we know the suicide rate among men, especially men our age, men in the middle years, much higher. And part of that is cultural in who we think we are and who we think we have to be.
Well, women of our certain age, to be generalizing, probably have better support structures, more friends, more willing to talk, more willing to open up.
You've nailed it all. Exactly.
What about teens, though? I mean, we have a really high rate of teen suicide, which I just find incredibly tragic.
Right. It is very, very sad. Suicide is the number one cause of death for our young people in about age 10 to 17. And again, that's complicated, but suicide often is a very impulsive decision, and teens make that impulsive decision in a very short time frame with less than that life experience kind of vision. There is a lot of challenges with social media in teens and bullying in teens. All of that goes into play with kids killing themselves.
Is there research that links social media and online bullying to increased suicide
There
rate?
is, right, there is. I mean, the research continues, but it seems pretty compelling that when we're not making social connections, face-to-face live connections, and we're making electronic connections, that's not as supportive, that's not as healthy.
Yeah, it's extremely mediated communication. Yeah. I mean, I know a gentleman, a guy I worked with tangentially years ago, his teenage son broke up with his girlfriend and he went home and hung himself.
Yeah.
I mean, it was, wow.
That's what's happening with our kids, because they don't have resiliency skills, they don't necessarily see the long view and see, this may pass.
About guns. I mean, guns make it, for teenagers, if there's a gun around and you're impulsive and you're not good at making decisions, that just seems doubly frightening.
Guns are a lethal means of suicide, and that's why there's such strong efforts about means restriction in Utah, initiatives of the Utah Suicide Prevention Coalition. But again, that's part of our Western culture, is gun ownership, but we have to be safe in our gun ownership.
Is the teenage suicide death rate by guns higher in the Intermountain West also?
I don't know that particular data point. Kids kill themselves by guns, but I don't know specifically the data on
how
on suicide rates with guns. it's available. I just don't know it off the top of my head.
And like you say, we live in a fairly gun-friendly culture, right? Pickup truck with a rifle, you do deer hunting, or you shoot pheasants. I mean,
Right.
I grew up with guns. A lot of people
Right.
did. Yeah.
And the effort against of means and suicide, we know that about 90% of gun deaths are suicide deaths. So suicide prevention is largely involved, weapons and understanding the lethality of weapons. So it's not about gun control; it's about the appropriate storage and access to means.
Right. If a teenager is going to be impulsive, if the gun is locked up,
Right.
you've made a huge step towards curbing that.
Precisely.
Right. So, mental illnesses as they manifest. I mean, some children, I guess, are lucky if they get diagnosed right away. But I bet the way mental illnesses show is very different for a kid than, say, for a 50-year-old guy.
We know that in a lot of ways, mental illnesses are illnesses of the youth, because many times symptoms begin to manifest themselves in teenage years and a little bit younger. And so that's why if we can get outcomes, if we can get help, the outcomes are so much better. But there's always that complication of what's the difference between what a child is experiencing as a teenager versus what they're going through in their mental health condition.
Right. I mean, if I remember myself as a teenager, I was a train wreck, but I don't know as I was diagnosably mentally ill.
Right.
I was just a train wreck. Right.
NAMI has some really wonderful programming called Hope for Tomorrow, which is a secondary school curriculum piece where we have programming around suicide prevention, mood disorders, substance use disorders, and eating disorders that are in the secondary schools to help kids recognize what warning signs are and how to seek out help. So this is a fabulous evidence-based program that is available to schools to help schools, parents, families, and community with our kids.
So when we come back from a break, let's spend time on that, Hope for Tomorrow. And I know that help for college kids is also increasing out there. So let's jump into that when we come back.
Perfect.
Keep it tuned, talking with Kim Gardner from NAMI, Utah, about suicide prevention, about mental health, and how we can all get some help. Keep it tuned to SLCC TV. We are back on Community Roundtable. Thanks for keeping it tuned to SLCC TV. Kim Gardner, National Alliance of Mental Illness, Utah. Hope for Tomorrow, something that's actually working in the high schools currently. I mean, we talked about problems, easy access to firearms, lack of sort of long-term life knowledge, but here's something that can be done now to help kids now. So Hope for Tomorrow.
Hope for Tomorrow is a secondary-based NAMI Utah specific program taught in middle and high schools by health teachers, by counselors, by NAMI staff, with pieces to help kids understand suicide prevention, mood disorders, other kinds of mental illnesses, to help them recognize in themselves or in their friends challenges that they may be experiencing, and how to help and what to turn for resources.
So how to recognize if your friend's having a problem that's beyond just Sally said no to the dance or something.
Right. And it helps them develop some skills in helping themselves and those around them.
I know there's some research, and I think this is from England, not in the United States, that showed that youth who were involved in group activities, things like Girl Scouts or Boy Scouts, had better mental health when they were adults. Does Hope for Tomorrow do any kinds of group work projects like that?
It's a curriculum piece that's taught in the schools. So it's
in terms of classroom, okay.
Yeah, it's taught during the classroom schedule. But what you mentioned, I'm not familiar with that particular study in England, but we talk about risk and protective factors in the public health arena. And protective factors include socialization, include belongedness, include religious affiliation, include, family structure. There's many, many things. It includes treatment, so risk and protective factors are so critical when it comes to mental health and with suicide prevention.
I know that's been in the media a lot in Utah, and it's very anecdotal that religious affiliation is affecting kids, especially who are gay, lesbian, transgender, and our high suicide rate. But other people are saying the data isn't really there yet. It's just anecdotes for now.
We have attempt data, but we don't have any reliable suicide death data related to LGBT kids, and that's happening. That's happening as we speak. That kind of research is happening.
Yeah. So your work, Prevention by Design, related to Hope for Tomorrow, but bigger than that.
Right. Hope for Tomorrow is a NAMI program. Prevention by Design is a NAMI program, but Prevention by Design specifically is grant funding to coalitions throughout the state who are suicide prevention coalitions, mental health promotion kind of preventions, to help them do strategies that work in their community, that works best for them. And so it's a wonderful opportunity for local communities to have funding to do good in their areas.
And NAMI is all over the state, right? You have areas and branches. So what you're doing on the Navajo reservation might not be the same as Moab or Provo or Salt Lake City.
Right.
Interesting.
The local coalitions are driving by data what their needs are and how they can meet those needs.
So what are some of those needs?
So
what's not being met?
Right. You mentioned the Indian population. So we have a large Indian population in Utah in various locations, and so there is a need for greater care for and treatment among our native population, suicide prevention among our native population. Other areas may want to focus on something called man therapy, which is a humor-based, innovative approach to address that demographic of men in the middle years, to engage men in their own mental wellness and engage them in resources and help, ultimately to try to save lives. So there's lots of really wonderful things happening in the state.
So as we grow into middle age, find it funny, not quite so serious.
Well,
yeah.
I wouldn't. Yeah, it's not really that. It's just, okay, what can we do on an innovative level that will maybe bring men into the conversation that they might not otherwise do?
Yeah. So a few minutes left. If you feel someone in your family is suffering from mental illness, some specifics for what folks can do?
Right. So number one is be aware, be conscious, be sensitive. Don't delay if you're concerned. Call NAMI. We have some mentors who work directly, who are skilled peers that have that family experience that maybe could help with a child if people have questions. We have mentors that can help with adult challenges. Reach out to your family doctor, talk about it, but mostly don't be afraid. Let's talk, and don't try to just hope that it will go away. Get the help that you need.
And talk can be one kind of help, right? I mean, talk therapy certainly, but
absolutely.
For some people it might be medicine, for other people it might not be.
Right.
I mean, I know some people exercise, diet. So that's if you've got a family member, but if I'm suffering from mental illness, or a family member is, and he or she doesn't see it, what can you recommend? I mean, families can do interventions and whatnot, but then again, lots of people live alone.
Right. A lot of people do live alone, and they're afraid to reach out. So that's why part of the engagement process of NAMI is, let's not have people be alone. Let's engage people even when maybe they don't want to be engaged, but let's be caring and compassionate. So again, I just would say, turn to NAMI, make a phone call to us, whether you're a family member or if you're somebody that you don't know what's going on in your life and would like some help sorting that out, we can help.
It could just be a checkup.
Absolutely.
So what about this notion, and you hear this all the time, it's just craziness runs in our family?
There is a strong component of genetic involvement with brain disorders.
Okay.
All right. So it's that confluence between nurturing and nature.
Okay.
And there is a strong component of family history in schizophrenia and depression and bipolar disorder. There's also an important piece of the nurturing of our environment and those interplay.
So just because Grandpa suffered from mental illness, it doesn't mean you will, but it might mean you should be maybe extra aware or just be conscious or...
Exactly. It may mean that, well, it does mean that you're probably at a greater risk because you've got that family history.
And of course, Grandpa couldn't get the kind of treatments that people could get today.
Right.
So in the last minute, phone numbers, website, what should people do right now?
Well, jump on our website at www.namiut.org. That's available, on our website. There are robust services for suicide prevention through the Suicide Prevention Lifeline, but turn to help and don't feel alone. There are helps out there. You're not alone.
So Kim Gardner, thank you very much for being here. And thank you for your work as the Program Director, Prevention by Design, National Alliance of Mental Illness in Utah. Thank you.
Thank you.
And thank you for joining us on Community Roundtable. If you have a comment, if you have a question, or you have an idea for a future show, get in touch. Roundtable@slcctv.com. And you can find all our episodes online. Check it out, slcctv.com. I'm Nick Burns. Keep it tuned. SLCC TV.